What is the most probable diagnosis for a 17-year-old girl who has not yet experienced menstruation and has minimal breast development, a normal physical appearance, and a negative urine test for beta-human chorionic gonadotropin, and denies ethanol, tobacco, and illicit drug use and sexual activity, with a family history of color blindness in some cousins, based on the results of a gynecologic examination that shows a vagina without rugae and a cervix that is easily visualized, and a cardiac examination that reveals no murmurs, rubs, or gallops, with the point of maximal impulse at the left midclavicular line 5th intercostal space. By androgen insensitivity syndrome, bigonadal dysgenesis, C. Kalman's syndrome, Descartes Jenner's syndrome, be pregnant? The answer is C, which is Kalman's syndrome. This syndrome is caused by a lack of pulsatile GnRH release, which initiates puberty, resulting in primary amenorrhea without secondary sexual characteristics. It is often associated with anosmia or hyposmia due to olfactory bulbogenesis or hypoplasia, and can also lead to color blindness, optic atrophy, nerve deafness, cleft palate, renal abnormalities, cryptorchidism, and neurological abnormalities like mirror movements. The mode of inheritance can be autosomal recessive, autosomal dominant, or X-linked. Oral contraceptives are used to treat Kalman's syndrome, and for patients to get pregnant, they require further treatment with a GnRH pump. These symptoms align with the patient's condition, indicating Kalman's syndrome. The answer choice C is not correct. Androgen insensitivity syndrome typically results in the presence of breasts but a lack of axillary hair growth. This occurs in patients who have female external genitalia but are genetically XY. Typically, undescended testes are present and must be removed due to the increased risk of testicular cancer in these patients. However, this diagnosis would not explain the absence of breast development or the presence of a cervix in the patient described in the question. The answer choice B is not correct. Gonadal dysgenesis, also known as Turner's syndrome, is a possibility for a patient with amenorrhea, which would account for both the amenorrhea and the lack of secondary sexual characteristics. In this condition, without ovarian response, sufficient amounts of estrogen and testosterone are not released to stimulate puberty. However, the patient described in the question does not exhibit the typical physical features associated with Turner's syndrome, such as short stature, a square-shaped chest, a webbed neck, a high palate, and a short fourth metacarpal. Patients with Turner's syndrome may also have autoimmune disorders like chronic autoimmune thyroiditis, morphological abnormalities in cardiovascular, urological, and bone structures, and hearing loss. The answer choice D is not correct. Carter-Jenner's syndrome is a genetic disorder with an autosomal recessive inheritance pattern that affects ciliary movement. It is associated with several clinical manifestations such as bronchiectasis, situs inversus, chronic sinusitis, and infertility in males due to abnormal sperm motility. The answer choice C is also not correct. While pregnancy can cause amenorrhea, this patient denies any sexual activity and has tested negative for pregnancy.